Good morning, my people. I hope this video finds you well wherever you are in the country. It's 9:00 hours East African time. And let me start by appreciating you people for the continued support you are showing me and this channel. I do appreciate those who are commenting on my job, those who are benefiting from it, and each and everyone who is doing whatever little, be it by sharing, subscribing, and liking, to push this channel ahead. Feel appreciated. Those who have not subscribed, consider doing so. And I know by the end of this year, this channel will be greater than how it is at the moment. We are still discussing about malaria and most emphasis on malaria in pregnancy. We have talked about the diagnosis, and now we'll be looking at treatment of malaria in pregnancy in the third prong of effective case management of malaria illness for all pregnant women in malaria areas must be assured. In treatment of malaria in pregnancy under the prong effective case management of malaria illness, remember we said we have three prongs according to World Health Organization, which was intermittent preventive of malaria in pregnancy, insecticide treated mosquito nets, and the third one is effective case management of malaria illness for all pregnant women in malaria areas. I hope you get that. So let's talk about uncomplicated malaria. Pregnant women in the first trimester with uncomplicated malaria or of the species P. falciparum should be treated with quinine plus clindamycin for 7 days and quinine monotherapy if clindamycin is not available. Uncomplicated malaria in pregnant women in the first trimester should be treated with quinine plus clindamycin for 7 days and quinine monotherapy if clindamycin is not available. Artesunate plus clindamycin for 7 days is indicated if the above treatment fails. That means if combination of quinine and clindamycin for 7 days or quinine monotherapy fails, you can go for artesunate plus clindamycin for 7 days. I hope you get that. So let's be specific. First trimester, quinine plus clindamycin to be given for 7 days. Artesunate plus clindamycin, all artesunate plus clindamycin for 7 days is indicated if quinine plus clindamycin fails. It may appear a bit difficult, but you have to get it. Quinine plus clindamycin to be given for 7 days, or artesunate plus clindamycin for 7 days if quinine and clindamycin fails. That means you may start by giving quinine plus clindamycin. If it fails, you have another option of artesunate and clindamycin for 7 days also. If clindamycin is unavailable or unaffordable, because it's always expensive, if clindamycin is unavailable or unaffordable, then quinine monotherapy should be given. If clindamycin is unavailable or unaffordable, then quinine monotherapy should be given. An ACT is indicated only if this is the only treatment immediately available, or if treatment with 7-day quinine plus clindamycin fails all uncertainty about the patient compliance with the 7-day treatment. An ACT is indicated only if this is the only treatment immediately available, or if treatment with the 7-day quinine plus clindamycin fails, all uncertain about the patient's compliance with 7-day treatment. I hope we are together up to there. Second trimester. ACT known to be effective in the country or region, all artesunate plus clindamycin to be given for 7 days, all quinine plus clindamycin to be given for 7 days. Second trimester. ACT also known to be effective in the country or region, all artesunate plus clindamycin to be given for 7 days, all quinine plus clindamycin to be given for 7 days. If clindamycin is unavailable or unaffordable, then monotherapy should be given. The monotherapy is obvious, a quinine monotherapy. A point to note, and a very important point. Patients with HIV infection who develop malaria should receive prompt, effective anti-malarial treatment regimen as recommended in the relevant sections of these guidelines. Patients with HIV infections who develop malaria should receive prompt, effective anti-malarial treatment regimens as recommended in the relevant sections of these World Health Organization guidelines. Treatment or intermittent prevention treatment with sulfadoxine pyrimethamine should be given to HIV infected patients receiving clotrimazole or trimethoprim plus sulfamethoxam prophylaxis. Let me repeat this. Patients with HIV infection who develop malaria should receive prompt, effective anti-malarial treatment regimens as recommended in the relevant sections of these World Health Organization guidelines. Treatment or intermittent prevention treatment with sulfadoxine pyrimethamine should be given to HIV-infected patients receiving clotrimazole into brackets trimethoprim plus sulfamethoxam prophylaxis. This marks the end of our video today. Thank you for being with me. Thank you for following me. And let's continue subscribing, sharing, and liking my videos so that they may be recommended all over in the world. Let's meet in the next video tomorrow.